Hello, everybody. My name is Dr. Sarah Wooten, and I am here with All About Cats to do a question and answer for everybody. So I am going to wait for all y'all to hop on, wait for them to click the special buttons that they need to click. But basically, the gist of this next hour is that I'm here to answer any questions that you have. I am here to provide you the information that you need. I am here to have a good time. I am not here to be your veterinarian. I wish I could. I would love to be your veterinarian, but I can't unless we are together. So what I'm going to be doing, whoa, I see a couple of eyes. Hello. I see you guys. Hi. So, hey, everybody. I'm just going to keep talking about random stuff for a little bit as you all jump on. But hi, I'm Dr. Sarah Wooten, and I am here to answer your questions for the All About Cats website and Facebook page. So hi to everybody who's going to be here. Hi to everybody who's going to be jumping on. The gist is you can just type your questions into the chat, and I will answer them. Now, the thing that I have to say to all of you guys that I have to say every single time, hi, welcome, I'm so glad you're here, is that this cannot be considered actual veterinary advice because I don't have an actual relationship with you. This is for educational purposes only. This is not intended to replace your relationship with your veterinarian. This is just designed to supplement it and give you some extra knowledge. So hopefully I'll be able to help you guys today with some education and some fun. Right? We want to have fun. So pop your questions in that chat, and I'm going to be scrolling through and getting to them as I get to them, okay? Again, hi. Y'all are showing up. I'm so glad you're here. I've missed you so much. I can't believe it's been an entire month. Can you believe it's been an entire month? Right? So I do have to apologize to everybody because I am having some construction done on this building right now. And of course, it's going to sound like construction in the background. So hopefully not too much. And hopefully we can just get to going, okay? So let me slip this guy off. Okay. Again, before I start going to the questions, my name is Dr. Sarah Wooten. I graduated from UC Davis, right? Class of 2002 means I'm old. I've practiced for a long time, and I practiced on dogs and cats exclusively. Licensed for all animals, but I really honed in on those two animals. And today we're going to be talking about cats. We're going to talk about anything you want to do. So here is question number 1 from Anthony Ramirez. Hello, my friend. Thank you for asking a question. And the question is, what is the most effective flea treatment? Great question, especially because we are in flea season here, right? Depending on where you are on the globe, these critters are alive and well. They hatch anytime somebody comes near them. So they hatch in response to vibration, heat, and CO2. So what we're exhaling. Those are the cues for these little critters to come hatching out and find something to feed upon. Usually a dog or a cat, right? So what is the most effective flea treatment? In my personal experience, the most effective flea treatment depends on how bad your fleas are in your area and what the fleas in your area tend to respond to or not to respond to. So I don't know if you've noticed, but some of the over-the-counter products aren't very effective because these darn fleas, they are like building up resistance to these things. So it's really important to be able to use something to be able to have it be effective, right? So there's a couple of different options, right? There's the killing flea treatment, right? And those kill fleas, right? So those come in a topical or they come in an oral chewable. Then there are insect growth regulators. And insect growth regulators, something like Interceptor is a product that's out there. The brand name is Interceptor. The generic is Lufenuron, Lufenuron, Lufenuron. Basically what that does is it makes it so fleas can't replicate. So if you have a really bad flea area, you may need to use both insect growth regulator to keep the fleas from replicating and something that kills really fast and really quick and lasts a long time. What you don't want to be using is pyrethrins. They are permethrins actually. So it's very toxic to cats. And a lot of times people will just see flea products that are over the counter, they're at some pet store, and they're like, oh, this is great. Labeled for dogs, no problem. I'm going to put it on my cat. The problem is those products are toxic to cats. And what's even harder is some of the ones that are labeled for cats still have a level of toxicity. So you want to make sure to not use anything with the permethrins. You don't want to be using it on cats. It causes nervous system seizures, problems like that. I would stay away from pyrethrins and permethrins in general. The thing is, pyrethrins, and those are found in like the Hearts products. The pyrethrins are derived from chrysanthemums. Pyrethroids are the synthetic version. And the thing is, cats are very sensitive to these products. So you want to avoid them. No, don't use them. Instead, what the things I found to be very useful were some of the newer products. So I'm thinking your Simparicas, your Bravectos, and your NexGards. Those last a long time and they kill very quickly. They kill fleas very quickly. So those are my favorite kill products. You don't want to use Frontline unless Frontline says specifically for cats because it can be toxic. So I like those NexGards, the Bravectos, and the Simparicas of the world. If you are in a bad area, then you also want to maybe add in an insect growth regulator. And you want to treat all the animals in your household. So a lot of people will run into problems when they treat like just the dog, right? And then they're like, well, I treat the dog, but the dog is still getting fleas. Where are they coming from? Well, your dog's getting reinfested either from another animal in the house or from the environment. Fleas like to live in shady, cool areas like leaf piles or tall grass or under decks, places where wild animals like to lay down. So it's also important to make sure that you treat all the animals in the household because they can pass the fleas towards each other back and forth. The most common flea on the planet is the cat flea. And contrary to what you think, the cat flea infects both dogs and cats. That's right. So you want to treat everybody. The other thing is to make sure that you aren't having a bunch of fleas in your environment. Look up red line homes. Red line homes. Those are really bad flea infestations that actually will seem to get worse before they get better. And the problem is the bulk of the flea biomass, right? So when we're talking about fleas, we talk about them like the biomass, right? I don't know if you've ever watched The Deadliest Catch, but they talk about the crabs as a biomass, right? Well, fleas are the same thing. And if you see one flea, one on your pet, that means there's probably many in the environment because they jump on and they jump off. They're not like ticks. Ticks get on an animal and then they stay there until they're done feeding and then they drop off. Fleas are whores. They just jump around. They jump on everybody. They jump off. They jump back on. And they like to live in the environment. And there's lots of life stages of fleas that you need to think about. You got to think about the adult flea, right? That's the one that most of us run into. But there's also eggs, pupa, larva. All of those are the different growth, the different life stages of fleas, and those all live in the environment. They live in those piles of leaves. They live in tall grass. They live under decks. They love to live under your couch cushions, my friends, in pet bedding, carpets, right? I've seen houses that have been vacant for a while, and then somebody walks through. Remember, I told you fleas hatch in response to one of three things: vibration from somebody walking, CO2 from somebody exhaling, or body heat, right? So if you walk into a place and there's a bunch of fleas in the environment that need to hatch, you walk in, 2 days later, they've all hatched, boom, right? So red line homes tend to have more fleas in the environment than on the pets, and those can be very frustrating, and you may need to work with a professional to get those kind of problems taken care of. If you do have a bad flea problem, vacuum, 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 vacuum. Vacuums are your friend. Also, clothes washers are amazing. So you want to vacuum daily, right? Because you want to suck up all those life stages out of the house. You want to vacuum under furniture. You want to vacuum under couch cushions. You want to wash your bedding. You want to wash your pet's bedding. And you want to do that fairly frequently because as fleas hatch, you got to kill them before they replicate and make more. So it's kind of like a three-pronged approach, right? You want to make sure they're not in the environment. You want to make sure they're not on your pet, and you want to make sure the other pets aren't reinfesting your pet. So Dr. Dryden is a phenomenal researcher in the area of fleas. In fact, in the veterinary circles, he is known as Dr. Flea, and he has a website where you can get all of this information and more. So just Google Dr. Flea, and if you are having problems with fleas, hopefully that information will help you. Also, don't hesitate to reach out to your local veterinarian and see what they can do. Okay, so next question. Posh Sims. Excellent name. I love that name. Hi, I'm moving to a place with a small Yorkie and already a cat. How do we know they will get along? Well, great question. So just like people, pets are introverts and extroverts, and some are ambiverts. And that goes for dogs and cats. So some cats want to be around all people. Some cats just want to be by themselves. Some cats only like certain people. Funny thing is, Yorkies are the same way. Yorkies tend to be very bonded to just one person. So the way that you will know if they're going to get along is I would start introducing them in a neutral zone. And a neutral zone is someplace that is not your home. So maybe a front yard or a friend's house or someplace that is not the home of one of those pets. And then I would make sure that you introduce them in such a way where they can escape from each other. So if the cat doesn't want to be introduced, then you can't force it. Because if you try, you're going to get scratches, bites, all that stuff. So it can be helpful to divide the two between two rooms and separate them with a screen or a baby gate so that they can sniff each other on either side. It's important to make sure that your cat has vertical space to where they can climb and get away from the Yorkie. Because if your Yorkie is very extroverted and your introverted cat, you need to make sure that your cat can get away. And also, you don't want to be involved in that very much. You want to kind of just let it be organic and natural. You want to make sure that you're supervising and that, at least to start, that there's some sort of divider between them where they can see each other, sniff each other, but not get claws or teeth into each other. And then you want to make it really positive. So make sure it's quiet. Make sure that you've brought some treats and some toys. Make sure that it's calm. All those things will help you. And then you're going to just have to see how their relationship evolves, because they may be best friends. They may tolerate each other. They may hate each other. Right? So get them in a neutral space. Make sure that they have some sort of divider between them. Make it really positive, and good luck. Okay, here's a question. Hello, my friend, CA987 Kittens. Hi. Can some cats scratch you badly if you take away their food before they're done eating? I would say the answer to that question is yes. That tends to be more of a problem with dogs. Dogs will have a problem with what they call resource guarding. Resources to dogs are their food, their toys, their human, their beds, and sometimes they can get very possessive. Cats, I tend to not see that quite as much. So I would tend to not bother a cat while it's trying to eat, personally, as a professional. Because there is always the possibility that you could startle the cat, but they don't tend to have the same kind of food bowl aggression with humans that dogs can have. They can have it with other cats, oh, for sure. So in general, leave them alone while they're eating, and then you can protect your fingers, right? Okay, question. Hello, June. June. What to do if my cat keeps wanting to go on the dining table? Good question. So I was just reading somewhere about how now the American College of Behaviorists, which is made up of certified behavioral experts for animals, is recommending to not do remote punishment anymore with spray bottles. Yeah, and actually they have an amazing Facebook page. Just search American College of Veterinary Behaviorists because they are always putting out a ton of good behavioral recommendations and advice. And this comes from board certified veterinarians in behavior, right? So you know this is legit. This is legit stuff. And what I used to recommend is, spray them with a spray bottle or shake a can when they do it, because it's remote punishment and it won't be associated with you, and it will create a negative association with jumping on the table. Now we've evolved and we recommend different things now. Okay, so we're not recommending humans doing remote punishment anymore with their animals. And the reason being is because, and you've probably seen this before, once you've sprayed a cat with a water bottle, they become wary about it. Then they tend to watch for you to pick up the bottle and stop whatever they're doing or run away when they see you do that. But that doesn't decrease their motivation for wanting to get on the dining room table. So the other thing that you can try that could be helpful is just make the top of the table not a fun place to be. And you may just need to do this for a couple of weeks or so just to get it started and build an association in your cat's brain that no is a dining table and there's fun stuff someplace else. So a couple of ways you can do it: cover the table in saran wrap. Some cats hate that and they're just like, oh, what is this? You could put down saran wrap, and then you could put down some double-sided tape. Okay, so when they walk on it, they're just like, oh, this is not a fun thing. Why am I doing this? This is not fun. If they're doing it for food, I would not reinforce the behavior at all by feeding them on the table. Don't do that. Don't do that. If they're doing it for food, you might need to eat someplace else for a while so they stop associating the table with food. And just think about, other things that you could put on the table that makes it less fun. Some people put on, they'll cover it with bubble wrap, like the little bubbles, because it's just weird. Cats don't like it. So try and make it not fun for them to get on that table, especially if you're not involved, okay? No more spraying with water bottles. And hopefully that will help you. Okay, so again, welcome to everybody. I am so glad to see all of these little eyes and all these questions coming up. My name is Dr. Sarah Wooten. I am a veterinarian. I graduated from UC Davis, practiced for 16 years. Dogs and cats are my thing. So I am here to answer any of your questions that you have. Cannot give you actual veterinary advice because I'm not your doctor and there's this legal thing, but this is for educational purposes only. So take what you have and take it back to your vet, because I am not a substitute for your local veterinarian. No, I am not. Okay. All right. Good question. Cookie Beast. How do I help my cat exercise more? This is a hilarious question coming from somebody with the name of Cookie Beast. Thank you. You made my day. Okay. So yes, obesity in cats is, no pun intended, a big, big problem. When we brought cats inside our house, we helped them to live longer because they are not having accidents, they're not getting bit by dogs, they're not getting infectious disease, all awesome things, right? Yay! The problem is we brought them in, and these animals are not designed to just be sedentary animals. They are active hunters, and they're actually more active at night. Yeah. And so we bring them inside and then we give them this very delicious kibble that is very calorie dense. And sometimes they're bored and they don't have anything else to do. So they just eat. Then you take your cat to the vet, and the vet, what does the vet say? Your cat's too fat, right? So how do we help you with that? So one thing, it's the easiest way is decrease the calories in, increase the calories out. One way of increasing the calories out is to increase their exercise. So a couple things you can do. So you measure out their food for the day, and instead of just putting it in a bowl and letting them eat it, you can do a couple of things. You can put it in a couple of different bowls and then move them around the house, put them in different places around the house. So the cat has to move around. And even better if you put them up high, as long as your cat doesn't have any problems with arthritis or mobility, put them up on counters where they have to jump. And then they have to move around from bowl to bowl to bowl. Make sure to measure out their food for the day because you don't want to be overfeeding. We don't want to be overfeeding. We don't want to make it worse. Second, you can make a game of it. A couple different ways to do that. Take the food and toss a kibble. Toss it. Toss the kibble so that they have something to chase and pounce and eat. That's fun. We want them to have fun. So tossing kibble so that they can hunt it, right? Cats are hunters. Other things you can do, there are no bowl feeders. Just Google no bowl feeders. They're food puzzles. No bowl feeders are great because you can get little mice and stuff them with food that the cats have to hunt. Okay, so that's a couple things. The other thing, you can put their food up on their cat trees. Take them for walks, right? Some cats love being outside. Outside doesn't love cats, as we already know. Infections and hit by cars and big dogs, bleh. But if you put them on a leash, train them to walk on a harness, that could be a way to get them some extra exercise. Playing with laser pointers. Laser pointers are awesome. But you want to make sure that you are doing it in a safe way. So while I am talking, I'm just going to Google the for cats. I'm just Googling the type of laser pointers that are more safe for cats, because you want laser pointers that have a lower voltage, because if you shine a laser in the eyes of anybody, you're going to burn out the back of their retina, right? So you want to use a low wattage laser with a maximum power output of 5 milliwatts. 5 milliwatts. Second, you want to play with it in such a way that the cat can actually catch something. So normally they're jumping and flipping and trying to catch something, and then it just disappears. And that can be really confusing to their little cat brains. And sometimes they can develop compulsive disorders where they chase shadows because they aren't able to actually hunt anything or catch anything when they hunt with a laser pointer. So when you're playing with laser pointers, always make sure to allow the cat at least a couple of times to catch something. And the way to do that is you just, you're playing with the laser pointer over here, right? The cat's over there. Put a little treat down on the ground over here, and then have the laser pointer come, land on that treat. As soon as the cat pounces on that treat, turn off the laser pointer. Yay! Cat caught something. Yay! Okay? Laser pointers are great. Just use them safely, Dr. Wooten says. Feathered fishing poles are also a good way to get cats to move. Some people, yeah. So that's my ideas on that. Hopefully that is helpful. So shared and smash that like button. Yes, definitely do that. Okay, here's a question. Joseph Bullock, my cat has stones. What kind of treats can I give her? Okay, so good question. So I don't know if you guys know, but cats can get kidney stones and bladder stones and gallbladder stones, which is part of the liver system, biliary digestive system, just like humans. And bladder stones are more common than gallbladder stones. And bladder stones can be a couple of different kinds. They can get struvite bladder stones, which often are associated with urinary tract infections. They can get calcium oxalate, which is more of just, could be dietary, but also can be genetic. Those are and then there's several other types, but kind of your main ones are the struvite and the calcium oxalate. The thing about struvite and calcium oxalate stones is that they are both caused by different things. They require different dietary requirements. They require the urine to be at different pHs, right? Acidic or basic. And so the treatment for struvite is very different than the treatment for calcium. So my best advice to you, Sir Joseph Bullock, is to ask your veterinarian what type of treats are safe for your particular cat's condition. In general, you can do vegetable treats with cats. if your cat will have them. You have to be careful with protein treats because protein, when it's metabolized, changes the pH of the urine. And that's what causes those crystals in the urine to precipitate out into stones. So, Sir Joseph Bullock, go talk to your vet, ask them what kind of stones your cat has and what kind of treats are safe to give for that particular cat. Okay, here we go. Okay. Selenov, 1986. My cat is on Revolution. Revolution is, I neglected to mention that in my list of my favorite flea products, but it is one that I prescribed all the time to cats. And what I like about Revolution, it is very broad spectrum. I mean, it gets everything. But this particular cat gets bald patches where it's applied. Is that bad for his coat? Should I switch? Yeah, I would say that that is probably a reaction and that I would probably switch to something different. So, but I'm not your vet, so I would definitely talk to your vet, show them the bald patches, tell them exactly where you're treating, and then ask them what you could switch to. Okay? All right. Here is a good question. Another good question from Posh Sims. You're asking the good questions. Thank you. How do you know if your cat has diabetes? Is it just that they got fat? My cat's eyes aren't as blue and kind of blurry on the store food. I'm going to answer the how do you know if your cat has diabetes question because I'm not sure about this second. So the way to know if your cat has diabetes is if they tend to be the overweight cats. That tends to be more common. And the reason being is because the most common diabetes in cats is type 2. Type 2 diabetes is due to dietary problems. So these cats are too fat. They have too much fatty tissue on their bodies. And fat, as we know now, is not just an energy storage organ. It's hormonal. It's a hormonal organ. And if you have too much of it on your body, then your hormones are going to get all screwed up. Same for cats, same for dogs, same for people, right? So what happens with cats with type 2 diabetes is that they become resistant to the insulin. So they're still making enough insulin, but they're not responding to it. Good news about type 2 diabetes in cats, it is completely reversible if you help them lose weight. Isn't that great? But how do you know? Well, the way you will know is this cat will suddenly become, really want to drink a lot, pee a lot. They will be hungry. They will be eating a lot, and they will still be losing weight. Oftentimes, they will not look thrifty. And what I mean is their coat just doesn't have that luster. Maybe they're not grooming as much. Maybe they've got some dandruff along the back. Those are all telltale signs that something is off with the blood sugar and that cat needs to be checked out. So the cardinal signs of type 2 diabetes in cats, type 2, right? The reversible kind, peeing a lot, drinking a lot, more than they used to, eating a lot, and still losing weight. You see those things, you go talk to your veterinarian, okay? Oh, this is cute. I just want to put this up here. Roger Dana says hello. Hello, Roger Dana. Thank you for being here. Okay, here we go. Majida Adas. I'm sorry if I'm butchering it. I really am. Hello, my cat got neutered yesterday, 8 months old, and he was licking his privates, and I'm scared he'll reopen the stick. Yeah, okay, so that's a thing. So I would say that you need to get something on your cat that will prevent him from licking down there so that the incisions can heal. There's 2 incisions, one for each testicle, and those need to just heal. Generally in cats, they're left open, so they heal, but they tend to heal very quickly. But if you allow the cat to lick a lot, it takes longer and sometimes it can get infected. So talk to your vet about getting one of those cones for them. Yes, I know we all hate the cones, but there's a lot of different ones out there now that are not as crappy as those plastic hard ones, right? They have ones that go straight out. which are nice because the cat, all it does is it keeps the cat from reaching back around, but it doesn't stop any of their visual. I find if you put the cones on that are very narrow and forward, cats just don't like them. And who can blame them? Honestly, that I would not want to wear that. There's also bite knot collars that just fit right here. They have these collars sometimes in a cloth. They're blue cloth. So yeah, definitely call your vet today and say, cat's licking down under, need something to stop. And if they only have this thing, the face forward cone, ask them if they have any other alternatives or if anybody in town has other alternatives. If that's your only alternative, then you're going to have to deal with it. Maybe just take it off so the cat can urinate and defecate and eat and all of that stuff. But good luck to you, okay? All right. Okay, so I did have this question up there, Victor. Victor, I hope you were on the call or on the Facebook Live a little bit earlier. How do you have any ideas on how to keep a cat entertained, even if you can't play with them? No bowl feeders. No bowl. Nobowl. Awesome. Food puzzles. Food puzzles where the cat has to think and figure out how to get their food. There's a lot of that you can buy from like Chewy or whatever, or you can make your own, which is even better. So if you go on YouTube and Google make your own food puzzles for cats, they're going to give you all kinds of awesome ideas for ways to make them out of cardboard, make them out of cardboard rolls or egg cartons. Lots of good options on there. Alternatively, get a catio. Have you ever heard of a catio? C-A-T-I-O. If you have a yard and you have space, they have these awesome outdoor enclosures that make it so that your cat can stay outside and have a lot of fun, but they're safe. Catios are awesome. Other options. Some cats like the TV. There is cat TV available. So yeah, but that's a great question. So hopefully those help you. Okay. Whoa, we've got a lot going on here. Let me hide everything. Okay. So give me a second, friends. I am looking at this. Okay. This question. Krista, oh, I'm not even gonna try. Okay. How can a heart murmur be treated? My cat has a level 1. I need to travel and I don't know what to do. She doesn't like to go out, but I can't leave her anywhere and she gets scared easily. Okay, awesome. So can heart murmurs be treated? Yes. So it depends on what's causing the heart murmur. So heart murmurs happen in the heart of any animal, not just cats, when there's an abnormal flow to the blood. So normally when all the valves, there's 4 chambers in a heart. Same thing with cats. They have 2 ventricles and 2 atria, right? And the blood goes in the right side, goes through the lungs, comes into the left side, goes out the aorta, travels around the body, comes back in the vena cava, does the whole thing again. So murmurs can happen when there's a problem with any of the valves in between the different chambers of the heart. So if like a valve is leaky, then there's backflow and you'll hear that instead of lub-dub, you'll hear shh, shh. Murmurs can also happen when cats have a very low blood volume or they're anemic. Murmurs can happen with heartworm disease. Murmurs can happen when there are thickening to heart wall muscles. Murmurs can happen when there are holes in the heart that cause the blood to flow in different directions that it should. So it depends on what the cause is. To be honest, a level 1 heart murmur, depending on the cause, okay? Again, I don't know because I'm not your vet. But a level 1 heart murmur is very low. That's like, that's not very much at all. And it could be not a big deal at all. And so if you have concerns about your cat's health and your cat's anxiety as far as traveling, it's really important for you to make sure that you are talking with your veterinarian about this, okay? You need to say exactly what you just wrote in this little thing right here. This thing, you need to say that to your vet. And don't be scared, okay? Vets are people too. And we need to know what's going on inside your head so we can best advise you. And sometimes we get a little busy and we tend to brush you off a little bit, and we're really sorry. But we need you to advocate for your pets. So if you need to travel and you need to take your cat, you need to talk to your vet and you need to say, hey, I'm concerned about this heart condition and I am concerned about my cat's anxiety. I need my cat to be safe while I'm traveling and I need something for the anxiety. Okay, there's lots of options out there. Talk to your cat. As far as treatment for that heart murmur, depends on what's causing it. So again, your veterinarian, yes, you can absolutely treat a lot of heart murmurs out there depending on the cause, but your veterinarian is going to be your best resource. Okay. All right. Here is a question from the Staffa family. Hello, my friends. So what is the average cost of getting a cat spayed and also neutered? Great question. Okay. This cost is all over the map. It's all over the map. So you could pay $75 to have your cat neutered. You could pay $300 to have your cat neutered. You could pay $100 to have your cat spayed. You could pay $500 to have your cat spayed. It all depends on a lot. Geography. Where are you? Cities, more expensive. Some areas of the country, more expensive. Depends on if you're having it done in a private practice or if you're going to a low-cost spay neuter clinic. If you're having it done at a private practice, it's going to be more expensive. It just is, right? Unless they have some sort of subsidy that allows them to offset the cost. If you're having it done with a low-cost spay neuter or spay neuter clinic or at the local shelter, it's going to be less. So, I mean, I've seen cat neuters be as low as $25 at a low-cost spay neuter. I've seen them as high as $75. It's all over the map. So the thing is, you have to remember a little bit, you get what you pay for. So if you are going to one of those high volume spay neuter, man, they are moving those cats through there really quick. The other thing I notice is, and it may be totally fine. They're probably using the same anesthesia, the same pain meds, all of that jazz. When I notice, when I'm in private practice, I've been retired for 2 years, but what I noticed is I tended to see more post-surgical complications with people who chose to have their pet spayed or neutered at a low-cost vaccine clinic, shelter, something, because there was cost concerns. And I totally get it, guys. It's expensive. I get it. It's an investment in your pet's health. But what I tended to see was these cats would come in and they would have more infections at their incision sites. And they would tend to develop upper respiratory infections, either due to the stress or the fact that they're just moving so many animals through there. And there's a lot of microbes, there's a lot of viruses, bacteria, all that stuff. So they get runny eyes, stressed out. And people would not feel quite as confident in taking care of their cats after, because again, there's just a lot of cats going through there. So you don't have a technician to sit down with you and go over your discharge instructions and all the things you need to do. So a little bit, you get with what you pay for. That's not true everywhere. I've seen plenty of animals go through these low-cost spay neuters and do perfectly fine. But if you're nervous at all, I would go through a private practice. A lot of private practices also have wellness plans that include the spay neuter, and it allows you to spread out the cost over a period of time. So hopefully that answers your question. Call around, do your research. Make sure you know what you're getting into. You may see something that you're like, it's a spay and it only costs $75. And the private practice over there is going to charge me $350. I'm going to go with a $75, but just hit the brakes, do your research. See what that surgery, see if you could see what the surgical suite looks like. If I was going to get surgery, I'd want to know. See how they're housing the animals. Ask them, what pain meds they get sent home with. I've seen animals that come in to me after they've gone through one of these and they don't have any pain meds. And so of course they're in pain and that causes problems on its own. So do your research. That's all I have to say about that. Okay. Next question. Is my kitten panting because she's hot? It's 95 degrees, or is it a different reason? She also runs and chirps randomly. Awesome. Great question. So answer to the second part first. Running and chirping randomly, normal. Normal cat behavior. Not anything to worry about. Panting, not good. Cats don't pant to cool themselves off like dogs do. Cats, they will tend to pant if they're very stressed, or if they're super overheated, or if they're having some sort of respiratory problem. But it's not normal to see cats panting. So if your cat is panting, if your kitten is panting, like 95 degrees, that's not that hot. I mean, I guess it depends on what your heat index is. If it's really muggy, it could be a heat index of 110. So what I would do is I would make sure that your cat is in a cooler area if you can, and see if the panting still continues. Also see if the panting is associated with some sort of stressful event or something. If you're noticing the cat is still panting, get the cat seen by a veterinarian sooner than later, because panting's not normal in cats. Okay. And you just want to make sure that there's nothing going on. Could just be stress. All right. Okay. Okay. Jaguar 1, is my cat okay if it has a wet nose, or is this a sign of illness? Good question. Thank you for asking. So in general, wet noses are a-okay. A lot of people will ask, oh my gosh, my cat's nose or my dog's nose is warm and dry. Does that mean my cat has a fever? Not necessarily. Cats' noses they'll vacillate during the day, and they'll do different things during the day. And you'll notice that sometimes maybe the cat's nose is wet and cold, and then at other times it's warm and dry. Both normal, not a problem, okay? What's not normal is discharge from the nose. So if there's a couple of drips of water, not a big deal. As long as your cat is acting healthy otherwise, fine. If there is snot, yellow, green, white, not good. If there's blood, not good. If there's crusting on the nose, not good. If the cat is sneezing or acting sick or doesn't want to eat, not good. Those are all reasons to get your cat checked by a vet. Okay? All righty. Here we go. My adults. Okay. We all still here? Okay. I have 71 of you with me. I've got 18 minutes left, and I'm going to give you all of the information that I have. You ready? Okay, here we go. My adult cat is suddenly peeing very small amount all the time. Is this a problem? Well, Maisha Afroz, I cannot officially advise you as a veterinarian, as your veterinarian, because I am not your veterinarian. So this is for educational purposes only. But I would say that that could be a problem, because it means that your cat either has an increased urge, feels like they need to go pee all the time, or it could be that they're having difficulty peeing. Either of those are not good. So if you are noticing changes in your cat's litter box habits, then you need to ask the vet. And you may need to take your cat in and get a urine sample from your cat so that they can see what's going on. Okay? Yeah, I would definitely say, I don't know if it's a problem, but it could be. And definitely if it's a different behavior than it used to be, there's something going on. Something that's common in cats is, oh gosh, it has so many different names. FLUTD, feline lower urinary tract disorder, is the old name. FIC, feline interstitial cystitis, is one of the new names. It has other names, but basically it is inflammation of the urinary bladder that causes it to contract and feel pain. And then the cat either urinates more often, or sits in the litter box and strains and is just in the litter box a lot, or maybe they pee bloody urine. I know, gross, I get it. But those could be all signs of this interstitial cystitis, this inflammatory condition of the bladder. The weird thing is, guys, is this is usually not associated with an infection. It's associated with stress. Yes, cats get stress urinary cystitis, just like women. Who knew we were so similar, right? And so if you're noticing that, it could be some stress. And so you need to talk to your vet about your cat's stress. No therapy, no talk therapy needed, but maybe some changes in the environment. Okay, here we go. Next, LB. Hello, my friend. Just got a 2-month-old kitten who came in with a pouch of dry food and 1 can of wet. Do I have to stick to that brand? And how long? If no, what can I replace it with? Great question. So no, you do not have to stick with that brand, but if you do switch your cat's food slowly over a couple of days. Take 3 to 5 days, mix small amounts of the new food with the old food, slowly increase the amount of new food, decrease the amount of old food over a couple of days so that you transition your cat to a new food without causing any kind of stress or stomach upset. Okay? So if your cat is on a kitten food, you want to stay on kitten food till at least, I would say, 6 to 8 months of age. Okay? Cats, they tend to max out their maturity by then. If you want to switch your brand, that's fine. You can totally do that. Just do it over a couple of days. That's all I recommend. I would recommend not switching food all the time. Don't get a whole grocery store of different types of food. And the reason being, just maybe choose like 3 or 4 and rotate through those if you want to switch food. The reason being is because if your cat ever does develop any kind of ingredient problems or food sensitivities or any of that, we need to know what your cat is eating. And it's easier if there's less things to choose from for your veterinarian to be able to design something that will help your cat. Okay, so hopefully that helps. Okay, here's the next question. Are you ready? Maribel. Hello, Maribel. How are you? How long does a cat last when they are in heat, and what can you do to make more comfortable until you're able to spay or neuter them? Good question. So cats will go into heat and they will stay in heat until they get pregnant. Oh, yeah. And did you know that cats can have litters with more than one baby daddy? Yeah, those cats, man. So, we always say it's really important to get a dog spayed when they're not in heat. But cats, we can spay cats when they're in heat. So if your cat's in heat and you want to get them spayed, just talk to your vet. There might be a small additional surcharge because the surgery is a little bit more difficult, but the best way to help your cat is to help them not be in heat anymore, right? So get them spayed as soon as possible. In the meantime, keep them indoors. Try and minimize their interactions with other cats especially cats that aren't spayed or neutered. No, because then you're going to end up as a grandma. It's going to happen. And then get them spayed as soon as possible, right? If you were my client and I was seeing you, I'd be like, let's get you scheduled for later this week, because cat spays are not as difficult as dog spays, especially if they're in heat. Okay. Here is a question from Silver Angel. You sound like a superhero. Hello, I have a 2-month-old kitten. Wow, we got a lot of 2-month-old kittens going on. Hello, friends. And it is kitten season, by the way. And sometimes after she eats, she looks bloated. So today she threw up. How and why and how can I help her? Good question. Well, without examining your cat, I don't know why. Okay. So one thing that can make small kittens look like that is worms, intestinal parasites. I'm talking hookworms, roundworms, whipworms, worms. Very, very, very common in kittens. And so if your kitten hasn't been dewormed a couple of times, you probably want to get your kitten dewormed. Other than that, not sure. It's really, without having a physical exam, putting my hand on that kitten, I don't know what's causing the kitten to be bloated, and I definitely don't want you to scare you with like bad things that it could be. So the most common thing, worms. Get the kitten dewormed, see what happens after that. Have a veterinarian examine that little tiny creature, make sure there's nothing else going on. Okay. All right. Oh, I'm looking in the comment section and you guys are helping each other. How very decent of all of you. Thank you so much. Okay. Sarah Stowers is having some cat relationship issues. This looks very stressful, especially because of the amount of emojis that is involved in this question. Hopefully, Sarah, I can help you. I like your name. It's a perfect name. Okay. How can I help my cat not be afraid of my other cat? She will take off running and my other cat will chase her and she will make a horrible scream. Oh my gosh. So we were talking earlier that some cats are introverts. Some cats are extroverts. Some cats are ambiverts. Ambivert means that you're an introvert and an extrovert. Okay. So it could be that your one cat that is chasing could be an extrovert and just wants to play. Your other cat is likely an introvert, or maybe your cat that's chasing the other cat could be bullying that cat. Cats can be bullies. Did you know that? They can bully each other. They can bully each other around toys, resting places, time with the human, food. Ugh, they can be jerks to each other. And so it could be that there is some sort of relationship dynamic with these two that's going to require a little bit of separation time. So I would make sure that your cat that is getting chased has a place to escape to. Something high, something by themselves, someplace where they can get away from this other cat. Okay, that's really important. Number two, you want to make sure that each cat has their own set of resources. And what I mean when I say this is their own food bowl, their own resting place, their own bed, their own litter box. And those need to be in a separate place, their own cat tree, in a separate place from the other cat. Also, behavioral experts do recommend if you have multiple cats that you have one more litter box than number of cats. So if you have 2 cats, they recommend 3 litter boxes. And they do recommend putting them in different places if you can. Cats don't necessarily like to be lined up like they're at a urinal or something. They like some privacy. So you have to see whether there's any bullying going on. Lastly, maybe your cat that's chasing the other one just is very energetic and needs some extra exercise. So we already talked in this live session about different ways to help your cat exercise more. So maybe increase the exercise for the cat that is chasing, all right? Because maybe that cat's just bored. So that's another thing as well. Lastly, talk to your veterinarian about anxiety medications. Also, because not just medications, but supplements. Sometimes cats just get a little stressed out and they just need a little something extra. Another thing that would be amazing, that could be amazing and help you, is Feel Away. Feel Away, Feliway. I had a problem spelling there for a second. Feel Away comes in a spray, comes in a diffuser, comes in wipes, comes in a collar. It's a hormone that is designed to calm cats. It's the same hormone that mother cats release when they are nursing. And sometimes if you use a diffuser or Feel Away on their bedding or their litter box or something, sometimes that just takes the stress down enough so that they stop chasing each other. Definitely talk to your veterinarian about this because this could potentially escalate to more violence between the cats, or it can lead to that stress cystitis that I was talking about earlier. So you definitely want to nip this one in the bud. I'm so glad you asked this question. Good luck. Okay. Somebody. Iris. Hello, Iris. Can you give advice on aftercare for neutering more in depth, please? Of course I can. So neutering in cats is a fairly low-key surgery. Compared to all the other surgeries that we do, it's fairly low-key. Cats can be up and pretty active following neuter surgery within 24 hours. So what I would recommend is in the first 24 hours, stay with your cat as much as possible. And the reason being is because they may have they may have some nausea after anesthesia. They may have delayed reactions to any of the medications that were used. They may have a lot of pain. So you want to supervise your cat, stay with your cat, hopefully at least for 24 hours. If you can stay 48 hours after surgery, even better. Okay. You want to make sure that they have a nice place to rest that is quiet and out of the main traffic area. You want to examine the surgical site, which is just below their cute little butthole. You usually will see 2 incisions on the testicles. 1, 2, because they take them out separately. So you just want to kind of look back there, lift up the tail, make sure that there's not bloody discharge coming out, that it doesn't look red, swollen, hot. Those things are signs of an infection. All right. So you want to examine the surgical site probably every, 3 to 4 hours. Next, you want to make sure that your cat's pain is controlled. The reason cats lick is because it hurts, right? Somebody just cut into their testicles. That hurts. So you want to make sure that they have adequate pain control. Your veterinarian should have sent you home with enough pain control to get you through the first 24, 48, 72 hours. That is, keep going. Give it all as prescribed. Don't stop it early, because if you stop it early, suddenly it's going to start to hurt. And then guess what? They're going to lick. Okay. You don't want that. No licking. If your veterinarian sends you home with a cone of some sort, I hope they do, keep it on your cat. If your cat is struggling with it, call your vet. The first day after surgery, if they're doing well and they came home the first day, later that evening around 8 o'clock, you can usually offer a very small meal, like a quarter of what they normally eat. And then you can feed them normally the next day. After that, it's best to keep them indoors while they're recovering from surgery. Your veterinarian will want to see you back in 7 to 10 days to check the incision site. If you notice any sign of infection, redness, heat, swelling, discharge on the testicles, you want to call your vet. Other than that, and if they're acting sick, if they're vomiting, if they have diarrhea, if they're not eating, if they're acting very lethargic, call your vet. Those are reasons to call your vet. Okay? Hopefully that helps. Good question. Oh gosh. I'm not going to answer that one. Okay. Do you need a harness to walk a cat, or can you just use a collar? I suggest a harness because cats are Houdinis and can get out of their collars, and that would just suck if you lost your cat. So make sure to use a harness instead of a collar. Okay. All right. I have 3 minutes left. You guys are cracking me up with some of these comments. Okay, I got to put this one up here just in case. So you guys are talking to each other, but I'm watching what you're saying to each other. This one's awesome. This is somebody talking to, my cat is strong as a tank. Nothing can harm him. Always drinks vodka. This cat came from the greatest Russia. This comment just made my day. I had to put it up there, okay? All right. And so some of those other ones I'm not going to put up, but that's okay. All right. I have time for one more. So I am going to, you guys have a bunch of alcoholic cats. Okay, let's see if there's an actual question. Okay, all right. Here is one. Great question. Great question. Okay. The cowardly cat. How long can feline AIDS virus live outside the host as well as leukemia virus, for example, on feces, bowls of food, or saliva? Great question. We don't entirely know. We do know that these viruses are very, very wimpy once they get out of the host. So there's 2 viruses that we're talking about here. And you guys, if you have cats, you need to know about these viruses, okay? FIV, which is like HIV, human immunodeficiency virus. There's a feline version, feline immunodeficiency virus. And it is typically passed by bite wounds between male cats that are fighting. That's typically the way that I see it. I usually see it in the unneutered cats that are brought in by animal control. They tend to come back up FIV positive, and it's just a thing, right? Second one, FELV, Feline Leukemia Virus. So while FIV, it tends to be called the fighting disease, FELV is called the loving disease because cats pass it back and forth by being loving towards each other, just like the coronavirus, right? So they nose each other and they pass it back and forth, or they groom each other, right? And that's how they pass it back and forth. So how long can it live outside the host? There is not, as to my knowledge, I might be wrong. There is not a specific study that says how long these things can live outside. What we do know is there are certain diseases. Ringworm, for example. Ringworm gets on everything, gets all over brushes, bedding, pets, clothes, and it can live outside on the clothes or whatever for as long as it needs to. These viruses tend to be very wimpy once they get outside the host, and they fall apart very quickly. So, for example, like when I was working and I would see a cat that had FELV, I wouldn't necessarily think that I was going to take that disease home with me to another animal. Having said that, if you do have a cat with FELV or FIV, those cats work best in single family households or in households that the cats all have that same disease because they're just going to pass it back and forth. And if you are working with a cat, petting a cat that has either of these, wash your hands. Wash your hands after you do that so that you can not potentially transmit that to another cat. Okay, just wash your hands. If the cat climbed all over your clothing, it's probably fine. But if you are worried and you are prudent, which it's always good to be, change your shirt. Okay, wash your hands, change your shirt. There's not a big push for these viruses existing in the environment. They tend to just be in the cats. So great question. And that's all I have to say on that. Okay. All right, my friends, all of you misbehaving in the comment section here. My time is up. So I appreciate all of you for being here. If you have more questions for me or other amazing veterinarians, there is the All About Cats forum. Let me put it up here, right here, where you can come and you can ask questions on healthcare or nutrition or behavior or any of these things. And it's likely that either I or another veterinarian will give you a very good answer. So go to the All About Cats forum, get more experts, more expert advice for what you're dealing with. And yeah, that's about all I have to say. I am so thankful that you guys came and hung out with me, even you misbehaving in the comments, people. And I will be back again next month to answer more of your questions. So I hope you have a beautiful day, and I will see you guys in a